Hi, I am Estar MedSpa, your beauty MP, and this is our beautiful model here today for our clinician training, and she just decided to come in early. Today what we're going to do is to do some neurotoxin, and one of our favorites is new tox. So if you're looking for that glow, you don't want to look anywhere further. This is the kind of toxin you want in your body. What it's going to do for her is that it's going to help relax the muscles around her eyes, so when she smiles, she doesn't have those, wrinkles showing. Of course, she's seeking to have glass skin, and this is part of the reason that you can do to give you that glass skin that you're looking for. And also it relaxes the muscle, and it doesn't do a lot of movement when you talk, but it's also very natural. Then another thing that we love to do for her, she does this like every 6 months, is to relax the jawline, which is the muscle of the muscle. The muscle of the muscle gets overworked, and it can actually widen the face. Most dentists will refer that you get neurotoxin like Botox, Jeuveau, Neurotoxin, and that will help reduce you from grinding. I mean, some people will wear night guards, but they get tired of it and they just will not be able to put anything in their mouth when you're sleeping. So this is the other alternative that you can do, and most dentists will recommend that you get that to relax your muscle. So you want to tell everybody why you get this treatment then?
Yeah, so I wear retainers at night, and because of that I tend to clench my jaw a lot even when I'm not wearing them. So getting the neurotoxin into the masseters helps relax it a lot. Also helps with like headaches I might get because of clenching of the jaw.
Yes, so it's not only aesthetics, it's also medical reasons to be able to. And the another beautiful thing that happens for you and for most of our patients is that snatched jawline. So that's what we're doing. Yes. So we're just going to go ahead to put the product in exactly where it needs to be. So put your teeth together for me with your mouth closed, and you can feel it. It's right there. So yes, right there. And you want to turn this way all the way. I see her almost every 6 months, so I definitely know her face. Make it harder for me. Very hard right there. You can actually feel it. So that's what we're going to try to, relax it so that she doesn't grind so much when she's sleeping. So that's what we do. By the way, another treatment or a signature treatment we do is how we place the toxin. So if you're a clinician out there and you're looking to enhance your skills and add more pearls to how you make your patient stand out, because not everybody wants to have a loud Botox face. By treating the crow's feet area, we're able to relax the muscle in a way that we give the cat eye. Okay, so it's going to be a little bit after her results kicks in. Of course, we're going to show the before and after. It's going to be more of a cat eye. How you place the product is very important, so you can actually feel. Okay, so I feel I'm going to mark the area, and mind you, she has a more of a tiny face, so you wouldn't want to just go all over the place. Just stay within the margin where the tox needs to be placed, and this is just the small area. Patients with larger face or wider face, based on their ethnicity or genetics, you can notice that it's more wider jawline. So in that case, you're going to be able to go up a little further or a little down. But with her, it's just a small area and it's very prominent. So it's easy to just go ahead. So what I'm going to do for her is that by using Jeuveau, we have to go a little bit deep. I'll bring her back in 2 weeks. We assess if she feels like, okay, now my grinding, I don't feel like I'm grinding any further. I don't have headaches. My jawline doesn't hurt. I'm fine. And usually too, you ask her to do those animation. You're able to tell whether there's movement or not. So that's another way to know that the toxin kicked in. And of course, she's also going to let you know how she feels when she comes back. So we are done on this side. Then I'm going to go towards the eye. You're going to go this way for me. Now give me like a squint, like you're really squinting your eyes. Okay, so because she's been getting treatment, it doesn't really show, but she's way overdue. So we're just going to go ahead and place a little bit. She doesn't need so much, about 5 minutes on each side. Here. You don't want to go too much under the eye because sometimes it causes like a bubble and it kind of looks like it's swelled up. So you want to make sure that you know the right anatomy where you're placing the product so it gives the best results. I'll go ahead and treat. Squint for me again. All right, so very tiny there. in the orbital area, and this way for me. Very tiny drops in here just to help relax those muscles. All right. And now I'm gonna go on the masseter. So you're gonna turn this way. And based on the product that you're using, whether it's Botox, Xeomin, Dysport, it depends on how deep you gotta go or how superficial you have to go. With Jeuveau, I'm gonna go a little bit deep because that's when you get to the muscle, and that's how it works. So just, and you're amazing. And that's it. So she's gonna come back in 2 weeks and we assess, and we'll take it from there. Otherwise, thank you.